Hi, everybody. Ben and John Carl, if it's okay with you, we'll go ahead and get started. Thanks very much, everybody, for being here today. My name is Lisa Tepper-Bates in the Office of the Governor. We'd like to thank the Connecticut Nonprofit Community Alliance for bringing together today the nonprofit providers who have gathered for this call. We're grateful to all of you for what you do and for making the time today to talk with Governor Lamont. We do apologize for the technology problems this morning that forced us to reschedule. Thank you very much for your flexibility. Before we begin, just a few housekeeping notes. With regard to the call today, we will first hear from Governor Lamont. After the governor, we'll have some questions on your behalf from John Carl Casa, the CEO of the Alliance. There are also a few of our commissioners here on the call to help answer your questions. I'd like to ask the commissioners to introduce themselves. Ben, you should have had some commissioners advise that they were on the call. Perhaps that's not yet been the case.
Hi, Ben unmuted me. This is Jordan Sheff from DDS.
Great.
Lisa, thank you. This is Ben. I see DCF is now unmuted as well.
Hi, Vanessa Durantis from DCF here.
Thank you, Commissioner. And are there others as well?
I see Ann Foley from OPM is also unmuted now.
Great.
And I don't see anyone else, but please raise your hand, otherwise let Lisa know you're on the call.
Okay, thank you very much, Ben.
I think we were getting Dr. Carter, weren't we, Lisa?
Not to my knowledge, Governor, but perhaps that's the case. For this call, we are expecting the commissioners who have announced themselves, as well as, I believe, either Commissioner Delphine Rittmann or someone in her stead. So, Ben, look out for them to join as well. And potentially also Commissioner Lehman or someone in his stead from DECD. So if you could keep a lookout for them to join, Ben, that would be very helpful. So with all that in mind, we'll go ahead and get started with initial comments from the governor. We'll then go to questions from John Carl, and we will open it up thereafter to some additional questions. Many of you who are in the call, we'd like to ask that you use the chat function in Zoom to communicate your question to John Carl and Ben. And they will be running the traps and making sure that they collect in the questions, and they will then ask it on your behalf. For those of you who will be speaking on the call, I'd like to ask that you remember to identify yourself and your organization, since we do have some folks who are on the phone and not joining by video. Thanks very much, Governor. Over to you.
Well, thanks, Lisa, and good afternoon, everybody. And just give you a quick update on where we are. This is why we have state government, and this is why we need our not-for-profits more than ever right now, given the scale of the COVID crisis. It's obviously much more severe in the southern part of the state. One of the things I've been working on with the federal government and the federal delegation is to have them stop thinking in terms of states and start thinking in terms of regions. The hot spot is New York City, but that includes Jersey City and Fairfield County, the greater New York metropolitan area, where right now we have the biggest stress, probably 10 times more likely to be infected there than in the northern part of the state. We've done a couple of briefings with our congressional delegation. I'll be doing again this evening with Joe Courtney on the impact of the bill that wandered through Congress over the last week and is about to be passed. And that's money that will probably be able to hit the ground in the next 2 to 4 weeks. The only hesitancy you hear in my voice is I've become a bit like Missouri, show me, because when it comes to PPE and other necessary equipment, a lot has been promised and the delivery has been slow, which is why we're trying to do as much as we can by ourselves on our own waiting for the cavalry to come in from Washington, especially when it comes to the gowns and the masks and the ventilators. You know, that said, I think our hospital capacity is, we've had a little time to prepare, and we started preparing early. And in terms of facility space, we've been able to expand facility space. Getting rid of or delaying the electives and only doing the most non-urgent has opened up an awful lot of capacity for us. Capacity meaning ICU beds or those that can be retrofitted, but also more PPE and some more ventilators and nurses. We've had probably 1,000 nurses and other healthcare professionals that maybe thought they were heading into a nice retirement, have dusted themselves off back in the playing field and doing everything they can to back up and support our frontline healthcare workers. But we need you more than ever. And I know the intensity is different depending on what services you're providing and what constituency you're providing for. I understand from, you know, OPM that at least at a minimum, whatever the severity, we're maintaining all the payments for all of our not-for-profit providers. We've been able to release the fourth quarter allotments early just to ease a little bit of the financial strain that you may be under. Some have got less, some have got a lot more priority right now, or much more strain. We can talk a little bit later if you want about the Recovery Bridge Loan Program, which is also available to not-for-profits. Although I will say it's been loved to death already. We thought we'd probably have 500 applications for the short-term loan program, and we've got well over 2,500. A lot of what we're trying to do is bridge until the federal loan program comes into place. And again, that is money that is a forgivable loan for not-for-profits as well as for the small business community. I believe that's correct. And we keep people in place, and that would be one of the terms and conditions of getting that loan forgiven. Others, in terms of sources of new funding, as we sort through what we've got from the federal $2 trillion program, a couple of other things worth remembering. We're launching a major fundraising initiative called 4CT, and we'll be announcing that early next week. We've already raised millions of dollars from incredibly generous philanthropics around the state. As you probably know, that we focused that so far a bit on daycare in and around our hospitals for reasons that those providers have a safe place for their kids. We've done a little bit on education, but I'd urge the not-for-profit community to connect with 4CT and think in terms of specific projects that are related to COVID that you need money for now, and we'll be able to accelerate that. So that's a second place that we'll be able to, help in the near term. I'll just leave you with a thought that people sometimes take what you're doing for granted, sometimes take government for granted, but not right now. Not when we have this crisis. People are really stepping up. And I got to say, I've been so impressed with all of our commissioners. I know we got DDS and DCF, Vanessa's on, Ann Foley, Jordan, to answer your questions. We're working together every morning at 11 o'clock. We have a unified command. We collaborate. We make sure that these are working across different departments, setting our priorities, figuring out the funding as necessary. We're getting over 5,000 inquiries a day on our 211 information line. That's also 211.org. We've got that set up as a place where people can volunteer, as well as we try and answer their questions as best we can. And before I go, I'd love to hear from you, what you need, and more importantly, what you hear. What are the concerns you hear from the people that you're representing, and how can we do a better job of helping you? Back to you, Lisa.
That's great. Thank you very much, Governor. And we are in the process of working with Ben to make sure that all of the commissioners who may need to speak to help answer questions are unmuted. And in the meantime, if we could go, John Carl, over to you. Please go ahead.
Can you hear me? Hope everyone is well. Thank you for being part of the call. And Governor, thank you so much for taking this time out of your day to talk to people today. As you noted, it is a very important group doing great work for the people of Connecticut. And I also want to thank your staff, Lisa and Ben Arsenault and others who helped, because they were invaluable in putting this together. So thank you all. You talked a bit, Governor, about financial support for community nonprofits, and that's obviously a concern now and in the long term. One of the issues is that nonprofits are seeking compensation, they're seeking to be paid for along the lines of their normal levels of funding, whether or not people are coming in. Is that something that the agencies will be providing?
Ann Foley, are you on the call?
And I believe also Secretary McCaw is on.
Hi, good afternoon, Jean-Carl. Thank you for your question and for your communication thus far on the needs of our nonprofit providers and partners. We're very pleased to share with you that the state is committed to continuing support for our nonprofit providers. We're particularly concerned with your ability to continue to pay your staff, as well as maintain capacity for when the COVID emergency has concluded. The governor has authorized OPM to continue to make grant payments. So even if services are not currently being provided, or they're being provided at a reduced level, for those nonprofits that are paid through a grant, we will be providing payments to ensure that the nonprofit is held harmless, and we expect that the employees will continue to be paid and that no employees would be impacted with any layoffs. With respect to the state agencies that contract with nonprofit providers who are paid on a fee-for-service basis, obviously, as you know, when those services are provided, we do seek federal reimbursement on those Medicaid expenditures. We're not able to directly hold you harmless by continuing to pay you on a fee-for-service basis. However, we'd like to continue to support those particular nonprofit providers by working with DSS through the hardship process to demonstrate where you are incurring costs for which you have not received funding. We might therefore have to, once we identify that fiscal impact, we might have to pay you through a grant in order to hold you harmless. So further communication will be coming out on that, on how we'd like to work with you to have the information pertaining to a hardship request. I hope that answers your question.
Yeah, thank you. One of the other issues that have come up in terms of funding is the issue of the state making cost settlements and clawbacks that take money back during the course of the fiscal year. And providers would like as much flexibility as possible to ensure that they can remain in business. Can the state allow providers to retain revenue from their programs at the end of the year?
This is Secretary McCaw again. Thank you for the question, Jean-Carl. As you know, there are a few pilot programs whereby we are evaluating the revenue retention arrangement. Those pilot programs will continue. As far as a broader request to retain revenue from the program, our intention is to make sure that we hold you harmless. And so, given that we expect you will continue to pay workers during this crisis, and that we are going to ensure that you're whole in order to do so, we're not anticipating that there would be an unusual level of lapsing or unexpended grant funds. So at this time, we will honor the pilot program. We will not go any further in terms of retaining revenue, but at the end of the day, the goal is for you to have the resources to continue to pay your workers and to ensure that the capacity exists when the public health emergency has concluded, and we will continue to support you in that way.
Thank you, Madam Secretary, and thank you for your time today. We have on the call a couple of the chairs of the Alliance's Public Policy Committee, and I know they have a couple of questions too. I would ask Heather Gates from CHR if she could pose her question.
Good afternoon. Thank you, Governor, for joining us and answering our questions. I'm Heather Gates from Community Health Resources and the President and CEO. We're one of Connecticut's largest behavioral health providers, serving over 27,000 children, families, and adults every year throughout the state. My question is somewhat similar, but in a more specific way than the two that John Carl has asked. We all get funding from the state in the state accounts, the SIDS, and oftentimes there are barriers to move funding across those state accounts. So you could have a deficit in one and a surplus in the other, and then we end up paying money back out of the account with the surplus and are not able to make up for the deficit. So we're asking in this particular crisis if the state can work with both us and the legislature, actually, because those accounts are created by the legislature, in order to make it feasible to, as you mentioned earlier, end up being held harmless during this crisis.
Thank you for raising that particular issue. Certainly, if we need to utilize any FAC transfer tools to move money between SIDS to ensure that we're able to make you whole, OPM and through the governor's authority, we'll be doing so accordingly.
Yeah, Heather, this is Ned. I agree. I think we should be as flexible as we can, given the nature of the crisis. Can I just ask you a question, or others? Given the support you provide, a lot of that requires in-person meetings. Obviously, given the nature of how infectious this COVID is, are you able to replace in-person meetings with telehealth, or does that really not work given the nature of your constituencies?
The answer to that is it's a combination. We serve extremely high-risk adults with mental health and addiction disorders, as well as children with very substantial problems. And we have, in a pretty miraculous period of time, transitioned a large majority of our service to using telephonic and telehealth treatment and support. But there is still a need to serve people face-to-face in some instances, particularly to do evaluations of those who are in crisis. So we're employing a combination of methods at this point, and not, so that it works for the most part, but some of our clients also don't have the technology to take advantage of it. And so we are continuing to do face-to-face. I will add that it's another area of need in terms of financial support, because we have all had to scramble to put this in place in a state that until very recently has not been quick to adopt telehealth as a way of delivering services.
Yeah, thank you. I can give you one update. I spent a little bit of time talking about the the state's, bridge loan program. That's just tapped out. That was a non-forgivable loan just to help people get a bridge to the federal. And I said that was open for not-for-profits, but we got to take a pause on that so we can process everything we've got going so far. How is everybody else, if you mind my asking before I go, handling what Heather was just talking about, what we can do in person that has to be done in person, how we keep our people safe there, or what alternatives are there to in person just to keep the providers safe and the patients?
Governor,
Go ahead.
I was just going to say, this has Ben Shaken moderating the call. If anyone is able to raise their hand, I will try to call on folks to answer questions. I know, John Carl, you were just going to try to answer as well. Go ahead.
Yeah, thanks, Ben. Thank you, Governor. One of the issues that I know has come up is surrounding the consideration of folks who work for community nonprofits and provide services and care as essential. And you've done that in your, as an exception to the folks who are staying at home. But what they don't have is the same consideration for instance, for testing as people who work in hospitals, and yet they often have the exact same, if not, well, very similar contact with folks who may or may not be infected. Is that kind of essential classification something that the state can do for these people?
Yeah, John Carl, let me look at that. As you know, we've been badly stretched on the testing, and we prioritize those that are at the hospitals so we can get the COVID people quarantined in a separate area, and the nurse providers and doctors who are the front line and taking care. But your people are front line as well, and they're often interfacing with many different people over the course of the day. We've got some new protocols that may allow us to start expanding the testing just a little bit. As you know, we started out very slow on testing. We couldn't do more than 20 a day just 2.5 weeks ago. Today we're doing 700 or 800. We have to prioritize, but it seems to me that your folks on the front lines taking care of people person to person ought to be near the top of that list.
Thank you, Governor. I know that, I don't know if Fernando is on the line. Barry Simon from Oak Hill is here, I believe. If Barry had a question.
So Governor, yeah, thank you very much.
Hey, Barry.
And, I've interacted with many of the commissioners in dealing with this. So thank you all as well. Shout out to Jordan Sheff, who he and I have spent a lot of time talking through some of the issues that we've handled. And some of the issues that come up are actually caused because multiple contracts across the different state agencies are being dealt with a little bit differently. And so I guess you had asked how the state could make our lives easier. And if the state could, in those 11 o'clock meetings, have similar services under these multiple contracts being dealt with similarly, DOC, DMIS, DCF, DDS, judicial branch, and creating a unified plan across the state agencies that provide direction for, in particular, infection control and the treatment of staff or clients who become infected, that would be hugely helpful to us as an industry.
Melissa, do you want to start with that?
Apologies for the delay. I was having technical difficulties. Thank you for your feedback. Certainly from the perspective of holding nonprofits harmless and ensuring that financially you're able to continue to operate and are ready to bounce back after COVID, we are taking a unified approach across state agencies that support you and contract with you. So thank you for that comment, and that is our intention and our goal. We'll be trying to strengthen the communication as well. It sounds like you also had some feedback with respect to some of the guidelines that we're using with respect to COVID, and we'll certainly pass that information along to our unified command structure.
Great, thank you.
I think possibly this could be a good time to look at some of the questions. Ben, have you had a chance to examine some of the questions here?
I will pull one out of the chat box in 1 second, John Carl, but for now, we've got some folks with their hands up, so I am going to call on one. I will start with Jeff Bravin. Jeff, you are unmuted.
Very good, good.
40 minutes for 20 questions. That's a lot. That's a lot.
Hey, Jeff, I know the feeling. Whenever I'm on the phone with the COVID task force in Washington, I'm never unmuted.
Or like to me, like you took it early. Why people
Jeff,
do that?
unfortunately, I don't have translation.
Look, she could have watched us take it.
And
She has a
the
video
video's
of it.
cutting it out. Could you
The chat,
the chat room and we'll ask the question? Sorry. I am going to now unmute Mary Pat DiCarlo.
Good morning, everyone. This is Rick Sebastian, not Mary Pat. Mary Pat signed in for the Kennedy Center here in Trumbull. Governor and commissioners, thank you very much for hosting the call today. And thank you for your leadership as we can address this COVID-19 virus in a unified manner. Governor, it would be extremely helpful to our industry to have you declare us healthcare providers. And why that's important for us is it places us in a different category to be able to obtain those PPEs that we're going to so desperately need in our residential settings in the days to come. If we're to implement everything that you're talking about, where we can expect more cases to come to the forefront on a day-to-day basis, we can expect more of our residents in our group homes needing to be supported in that group home that then has quarantined employees. And without the personal protective equipment to take care of those individuals, we're putting even more families at risk that don't have to be. So I implore you to do some level of executive order and raise our status from a healthcare standpoint so that we can be in that priority list of getting those PPEs. Thank you.
Look, no, thank you, Rick. Here's the deal. There's a desperate shortage across the board, across the nation, right now across the globe. And it's very disappointing that the federal government didn't wake up to this till much too late. We are putting our entire Department of Administrative Services, DAS purchasing team in terms of focusing on getting this protective gear. In the meantime, we've got gloves, we've got some masks, we've got some things we can help for the near term, but not nearly enough. So I'm trying my best to figure out how we, who gets and who doesn't, and how we prioritize that to make sure that we're ready. It's coming up fast via New York to Fairfield County, and I've got to do a better job of not just prioritizing, but getting access to more PPE. And I'm so proud of some of the entrepreneurship I see out there. People are beginning to make their own masks. The parachute company is beginning to make the protective gear. It's not all that we want, but it's what I can control myself rather than just sitting around rattling the cages in Washington, D.C., which we do on a daily basis. But Rick, I hear you loud and clear.
Thank you, sir.
Ben, Jeff had posted we had trouble hearing his translator. He had posted a question on chat, and I'd like to pose it for him.
Go ahead.
He's talking about the School for the Deaf, Governor, that also has a residential treatment program licensed by DCF. They are open 365 days a year, 24/7 for deaf and hard of hearing students. Some have gone home but need to come back because of the need and support they can get from the program. What can we do to allow them to return back to the program? And he has a second question, that is, we have staff here who are anxious that if they're hit with COVID-19 symptoms, we can't just send them back home, and will the state give them appropriate equipment or place to put them? And that is a question that has come up, I know, from a number of providers, that they simply don't know what to do with somebody who has become sick. If they're in a residential setting, for instance, which could be a setting that has many people in it, or in a different kind of program.
Yeah, let me start, then hand it over to Vanessa before I go. But in all group homes, nursing, all these facilities, we're trying to at least prioritize testing there. And short of testing, we're in the docket to get thousands of thermometers. This is not exactly what you wanted to hear, but we can at least do a fever test for people going in and out of group facilities, making sure that most of these group facilities you have as few people being able to go in as possible. As you probably know, just because the nursing homes are petri dishes for this infection, we virtually said no to any outside people not related to the healthcare space itself. And Giancarlo, if somebody has symptoms, ill, not feeling right, they've got to go home. And I've got to find a better way to make sure you have somebody who can temporarily replace them. Because what that means in terms of the folks they're caring for, not to mention themselves, is a risk that we just can't take. And, you know, we have obviously paid sick time and family leave. We can make sure that they get compensated for the time they're not able to work. But I've got to make sure you have people there that can place them, because the folks they're caring for aren't going away. Look, I hear the stress and frustration in everybody's voice. I hear that across the state. You know, and I understand what we're trying to do here. I just got to tell each and every one of you what we're doing in terms of the financial resources, what we're doing in terms of facilities, what we're doing in terms of additional space. You know, those are things that we have a lot of control over. The PPE thing, you know, going back to Rick and others, we are doing everything we can to get that up front, get that allocated, get that to use. And basically all of our partners in this, including the health providers, are being really aggressive about how they can reuse, how they can bleach, and make this go a little bit further. It's not the answer you want, but it's the answer the way it is right now. But I got to tell you, we hear loud and clear the urgency in this. And I strongly think that we're going to have some breakthrough, but it won't be tomorrow. And tomorrow is a long way away. So I understand what we got to do, and we're going to do better. Giancarlo, with that, I just got to thank you and all the people you represent. You know, the care and heart and efficiency you bring to a lot of folks who need you now more than ever. And there's no way to telecommute this. There's no way to, you know, ratchet it back. These are folks we got to continue to provide the service for. And I'm going to do everything I can within my human powers to make sure we can support you along the way.
Well, Governor,
with that,
again,
you've got some of our best commissioners in the world on the phone. They can better answer the questions.
thank you again so much, Governor. We appreciate it. We know this is a particularly difficult time for everyone in government, but especially for you. And we appreciate that you took the time to talk to us today.
Okay. Thanks to you and all you do. Take care, everybody.
Thank you.
So at this point, Giancarlo will ask folks if they have questions. We are lucky to have so many of our commissioners still on the phone and able to continue answering questions for another 15, 20 minutes. Ben and Giancarlo, would you be kind enough to tell us what the additional questions might be?
Sure, Lisa, I just have one clarifying question that's come through the chat box a few times. At the beginning of the call, the governor mentioned the forgivable loan program, and his voice got a little garbled when he was talking about the name of it. Could you or Commissioner Lehman?
I'll defer to Commissioner Lehman, who I know is on the line. If you could unmute him, Ben.
Commissioner Lehman, you should be unmuted.
Can everyone hear me now?
Yes.
We can.
Great. Sorry. Let me just provide a bit of clarity on that. So there's a couple different loan and financial alternatives that are out there. At the state level, the program that we launched was called the Connecticut Recovery Bridge Program. And those were loans up to $75,000 for small businesses and nonprofits at 0% interest for a year and a half of total term. As the governor mentioned there, so just a couple things to be clear on this. This loan is actually not a forgivable loan. This is just a regular vanilla short-term loan at 0% 4% interest. We have received over 4,000 applications since yesterday morning, so there's been tremendous interest from small businesses and not-for-profits. We, at this point in time, we're doubling the size of the program from 25 to 50 million. We're also throwing more staff resources at it. But given the amount of applicants we have right now, at the end of the day today, we're going to hit pause on taking new applications just to be fair to those that have come in, because from a staffing perspective, we want to make sure we can turn around what we have quickly. So for folks that have applied on the phone, we appreciate it. We're going to get to your application as quickly as possible. And for those that were contemplating applying, we'd encourage you to do so this afternoon, because from a resource perspective, we just don't want to take any more applications when we can't get back to folks in time. So we're going to hit the pause button there. The federal stimulus, though, I think is important to spend a bit of time on, and this was just passed in the House. Importantly, these are forgivable loans. So the main program there is called the Paycheck Protection Program, or PPP. This is $350 billion of funding for small businesses and certain not-for-profits. To the extent that they maintain their payroll for a 2-month period, the loan is completely forgiven. So you need to maintain your salary in the federal, you need to maintain your employment in the federal program, and they will pay for 2 months worth of operating expenses and payroll costs, and then it is effectively a grant. So that is a very significant program that will be administered by Connecticut banks. So when the president hopefully signs that into law today, ultimately banks will be able to provide those loans. They're going to get the funds direct from Treasury. They're guaranteed by the federal government, and then after a 2-month compliance period where you maintain your payroll, that will become a grant. In addition, I want to mention the SBA, the Federal Small Business Administration, has 2 other programs. Importantly, there is an Emergency Economic Injury Disaster Loan, or EIDL, and you can apply for this online right now through sba.gov. But in addition to an up to $2 million loan you can apply for, in the stimulus that was passed today, there's $10 billion in funding, where in addition to those loans, there's 10,000 rather, in grants for small businesses and not-for-profits. When they apply for that loan, within 3 days, they're able to get a $10,000 grant from the SBA. So that is new, and that is significant, because that is $10,000 in money that should happen very, very short. And even if someone is not approved for the SBA loan, you do not need to repay the grant. So I'll stop there. I'm happy to answer any more questions, but the federal stimulus is very significant. The state program we've had significant response to, and we hope to start that up again in the future. But right now we're going to process all the applications in the pipeline.
And Commissioner Lehman, just to be clear, there's information on all of these programs available at the DECD website. Is that correct?
Correct. So the DECD website has our program, and then we have a hotline set up, 860-500-2333, to answer any questions about the federal program that's still evolving. But we're working on sending out a press release right now with links to the information that I just mentioned on the federal program.
Thank you, Commissioner. Fernando Muniz from Community Solutions is another of the chairs, along with Barry, Simon, and Heather Gates of the Public Policy Committee. And I know he's on the line now, so I'd ask Fernando. I know he had a question. I'd ask Fernando to pose it.
Sure. Good afternoon, everybody. I apologize for arriving late to the call. Obviously, the change in schedule made things a little bit tricky today. There are a number of questions, obviously, that we have about designating human services providers as essential staff during this time and making sure that the state makes a long-term commitment to funding. The criminal justice providers in particular, I don't know if this has been brought up, are very concerned with the Department of Corrections' current position of filling just about every bed in the halfway houses across the state. We are very concerned that that poses a public health risk, and that if one of those facilities were to be quarantined, right now we don't have any place for the staff to sleep. It's been our experience from what we're hearing from other states that facilities that have been quarantined for up to 14 days, staff wouldn't be allowed to leave the facility for that time period.
Thank you, Fernando. We do not at this time have a colleague from Department of Corrections on, but what we will do is certainly take that question back and try and get back to you through the Alliance or directly with a response.
Thanks, Lisa. This is Ben Shaken again. I have another person with their hand up, and so before I call on them, just quick piece of housekeeping. If you are using the Zoom app, if you click on participants, and then you should be able to see a button that says raise hand. You can raise your hand and I will try to call on you. We also have a very long running list of questions in the chat that I will get to after this person. And then if we have time at the end, although I doubt we will for folks who are on the phone, I will unmute everybody and allow you to unmute yourselves all at once, and maybe we can get a question in from the phone. But for now, Amy O'Day has her hand up, and so I am going to unmute you, Amy, and if you're still there, you can ask your question. Amy? Okay, I think we lost Amy. That's okay. I'm gonna pull a question out of the chat box. We had a question earlier about affordable housing providers and the bridge loan at DECD, which excludes real estate. Does that also exclude affordable housing providers? Also, there's a personal guarantee requirement for that program, which is incredibly difficult for nonprofits. And is it possible for that personal guarantee requirement to be waived for nonprofits?
So it's David Lehman. Can everyone hear me still?
Yes.
Great. So on the first question, so real estate related businesses are excluded from applying. So if it's an operational business around housing, for example, that could work and will likely work. But if it is a business that owns real estate or operates real estate, even if it's affordable housing, that would be not eligible for the program. We're trying to comply as much as possible with what could be a bridge to an SBA or other federal program, which is why we have some of the prohibitions in place for eligible businesses and types. On the second question, as it relates to the guarantee, you know, what I would say is we're willing to work with folks on that front. The reason we're asking for guarantees is we're at a point where we're really not able to do a significant amount of diligence, and what we're really looking for is there a backstop of sorts or someone that is willing to speak for the loan? You know, again, that is not a hard rule in terms of we absolutely need that, but it's going to be important in us trying to make quick credit decisions, because we're going to look at historical financials and understand the balance sheet and income generating ability of businesses and not-for-profits, whether that's fundraising or funds coming from the state or other places that would ultimately repay this financing. So it's going to be a case-by-case basis, but that's why we have the guarantor language there to try to process this quickly, given we want to get the money out very, very soon.
Thanks, Commissioner. Another question from the chat box, and a question I think some providers had before the call. The governor spoke earlier about telehealth and asked a question about it. And part of the answer that Heather gave had to do with standing up that service so quickly, and including the need for both staff and clients to access technology. Is there any either funding pool that can be made available or other mechanism for nonprofits to purchase Chromebooks, tablets, cell phones for clients, et cetera, so that they can access telehealth services at this point?
Hi, this is Secretary McCaw. At this point in time, there is not an existing fund available for the purchase of technology.
Thank you.
One thing, it's David Lehman. One thing, and I'm not sure if Lisa mentioned this at the outset, but there is a broader philanthropic effort that is going to soon be announced, where we're hopeful we can start raising some of those funds to potentially provide some of those services and items.
That's right, Commissioner Layman, and thank you for mentioning that. The governor did mention the 4CT effort, and so we do hope to have more information available to help you understand what that opportunity might mean going forward.
I'm not sure who the proper person is to ask this of, but I know that questions have come up over the last couple of weeks about how employers, nonprofits who are here, can handle or should handle paid time off for their employees. What can they expect from the state in terms of that?
I know that Andrea Barton-Reeves is on the call. Andrea, are you in a position, we don't have Department of Labor on, but if Andrea might be able to answer any of those questions, can you raise your hand?
Andrea, you should be unmuted. Are you there?
I am right. Yes, I am here.
Hi,
So thank you for allowing me to join your call. So if I knew specifically what the questions were, then I could probably provide you with some more guidance. I can tell you generally that from the paid medical leave perspective, we're following the guidance that we're getting from the federal government and initializing that and operationalizing it, I should say, through the state. So if you go onto the U.S. Department of Labor website and you have questions about the number of employees, these are the most frequently asked questions I'm getting so far, which are, do I qualify or do I have to participate because I have fewer than 500 employees, I have more than 500 employees. There are now 3 different statutes and acts that have been passed in the last 7 to 10 days, so I know that all of it is very confusing. The fact of the matter is that we are still parsing through some of that, but at this point, if you have 500 employees or more, then you do have to comply with the specific laws that have been passed that require you to provide paid sick leave and emergency COVID leave. And if you have specific questions about that, I can take those questions, I can provide you with some answers, and I can give those to John Carl to share with the Alliance members in general.
Thank you, Andrea. I know we got a question about whether or not there's been thought about approving telemedicine from off-site locations. So for instance, people who aren't currently working, say at a school-based health center, could be providing telemedicine for their students, similar to what LCSWs are doing. So I don't know who that question would go to, but that's come up a couple of times in the past few weeks.
I think, John Carl, that's a question that we will have to take and then work through the Alliance to come back with an answer. There's been a lot of movement with regard to what previously was not allowed and what is now allowed on telemedicine. So unless one of the commissioners on the line believes that they can answer that question, I'd suggest that we will take it back and work with Office of Health Strategy, Department of Insurance, and also DPH to understand what's possible. And we can then respond through you back in writing.
Okay, thank you. You know, I do want to mention, I wanted to mention when the governor was on that we appreciate that during the call that Commissioner Lehman had, that there was discussion of the arts and culture and their importance to the state. And I know at this time when we're all sort of locked up in our houses, it takes on particular importance. So I don't know if Commissioner, if there's anything you wanted to add for folks who may not have been on that call who deal with arts and cultural organizations.
Hi, it's David. I'm trying to think back to last Thursday was like 3 lifetimes ago at this point. I'm not sure if there was a specific content that you wanted me to go through on this call that we went through on that call. I'm happy to, but I'm just not recalling specifically what it was.
Really, it's just a broad question about the kind of financial support that arts organizations can look for over the next few months. Keep them afloat.
Yeah. No, understood. And I really want to underscore this point. The federal stimulus, this $2.2 trillion, in addition to what we're trying to do at the state level, you know, that the goal is for that to support nonprofits in addition to businesses, and for folks to try to ideally maintain their payrolls during this really challenging time period. And to the extent that there have been layoffs, so there needs to be reductions in staff given the issues on the revenue side, the enhanced unemployment benefits that are in this federal stimulus as well are very, very meaningful. So it feels like my read of the federal bill is most nonprofits are able to take part in that. I think the federal bill is trying to exclude a certain small segment of the nonprofit industry, but I don't believe it's the folks we have on the phone as I read it.
Mm-hmm. We have a hand raised on the call from Tim Bartlett. Tim, you're unmuted with your question.
Thank you. I'm not sure who this goes to, but I'm one of the nonprofits that has more than 500, and most of what we've seen passed doesn't apply to us. We don't get the forgivable loans. You know, we have over 1,000 employees. Most are part-time. I just like someone to remember that, you know, we serve over 26 towns, and we can't be the only people that we could use some assistance. Specifically, we self-fund our unemployment, and based on what we saw from the CARES bill and the new employment rules, we're looking at over almost $4 million of exposure. You know, what can the state do to help a nonprofit like ours, you know, manage that type of number?
So Tim, it's David Lehman again from Economic Development. I'm not familiar with your organization and what things we can be doing that the federal bill is not addressing. Take offline, but I don't have a response for you right now because I need to understand more.
Okay, I'm sorry. I'm with the Central Connecticut Coast YMCA. We have 13 different YMCA branches all over the state, and everything really has been geared towards nonprofits of 500 and below.
No, understood. And both at the federal level and most of the state initiatives in Connecticut, in a way, have been very focused on small and medium-sized businesses. So I take your point.
So this is, hold on one second, actually the Secretary McCall. Secretary, you should be unmuted.
Thank you. Thank you. In addition to Commissioner Lehman's feedback, just wanted to remind you, perhaps if you weren't on the call earlier, on the extent to which you are a nonprofit where you're currently receiving grant funding, for example, for services that you provide. The governor has directed that we maintain continuity in those payment streams and to allow you to continue to meet payroll and some of those fixed costs. If you're a fee-for-service type provider, then we would like for you to use the hardship process to demonstrate where you're feeling the impact of COVID, as well as what your costs are to maintain employment for your population. So those are the tools in terms of honoring the commitments from the state perspective in funding your programs and ensuring that the capacity still exists when we're all beyond the COVID public health emergency.
Thank you, Secretary. Before we go, we're getting toward the end. A couple of things. One thing, we appreciate how the state folks have been willing to communicate through us, and any questions that have come up that they give us answers to, we will pass along to you, as well as questions that didn't get a chance to be answered here today. We'll try to get answers to those too. And what we'll do is for those of you who are members of the Alliance, we've been sending out updates every couple of days that include links to resource pages from all over the place. So it's not just state agents, every state agency that's affected, but also national organizations and CDC and a variety of different organizations. So we're trying to keep the updates flowing as information changes. If you did not get a chance to get your question answered today, you can email it to any of us here on the Alliance staff. You can email it to me, gcasa@ctnonprofitalliance.org, or if you work with one of my colleagues, Ben Shakin, Brunilda Ferre, Jeff Shaw, and Julia Wilcox, any of them would be able to help you too. And everyone's email is the first initial and the last name.
Thank you, John Carl. And just on behalf of the governor, I want to thank you all for making time again to be here today. Please know that this call was something very important to him. He appreciates the work that you're doing. And it is a priority to stay in close touch with you, including through the help of the Alliance. So thank you for being here. And as John Carl said, we will in the Office of the Governor be working to help respond to the questions that we took during this call and to any additional questions that we were not able to get to with you. So thank you very much. And John Carl, just to repeat, this will be available, this call will be available as a recording on your website later today. Is that correct?
As soon as we can get it formatted and up, Lisa, yes, the recording will be available. Also, just so everyone knows, we will be saving the contents of the chat box and all the questions that everyone had. We will do our best to formulate them to the various state agencies and try to get answers for all of you. Again, if you have additional questions, please just email them to us. John Carl's email is gcasa, C-A-S-A, at ctnonprofitalliance.org. That's gcasa, C-A-S-A, at ctnonprofitalliance.org. And we are doing our best to keep in constant contact with all the different state agencies. So thank you all very much for taking the time today. And Lisa and everyone from the administration, thank you for taking the time, and Governor Lamont as well.